Welcome to the Cleveland Clinic South Pointe Orthopedic Surgical Residency educational video series. This series was created for educational purposes designed to aid in patient care and teaching proper steps and techniques for commonly completed bedside orthopedic skills and procedures. In this video, we will provide a demonstration on the proper technique for completing a hematoma block, distal radius reduction, and sugar tongue splint application. Begin by removing all rings or jewelry from the patient upon arrival and examination. Next, you should prepare supplies for a hematoma block. This can be completed with a 10 cc syringe and local anesthetic. Start by sterilizing the desired site of administration. Note this should be at the fracture site. A common mistake observed is injecting distal to the fracture site more near the wrist joint itself. Correlate radiographs and palpation with your desired injection site. The 18-gauge needle should be directed from proximally to distally at a 45-degree angle from the forearm, with the needle bevel up. Then, proceed to aspirate, ensuring blood is returned, confirming you are at the fracture site, and barbotage as you then inject the anesthetic. Place a Band-Aid and prepare for your reduction. As the wrist becomes numb, roll out your pre-measured splint with at least 10 to an ideal 15 sheets of plaster. Once numb, complete your reduction maneuver. This generally requires more force than anticipated and involves first accentuating the deformity. In most cases, the wrist requires a dorsal to volar movement to restore the volar tilt while providing traction. It is important to note once more that this is the most common reduction maneuver, but not the only reduction maneuver. For further information regarding other wrist fracture patterns and correlating reductions, please see our attached PowerPoint slideshow on distal radius fractures. After confirming under fluoroscopy your reduction, you may apply your splint. Begin by positioning the patient so as to maintain your reduction. This requires an assistant holding at the hand and wrist in an alternately deviated position, while also providing countertraction to the elbow. You may choose to complete the prior step with your stockinette already in place, but in either case, place a stockinette about the arm and instruct your assistant on proper holding. Prepare thumb holes by cutting the stockinette at the appropriate level. Begin wrapping from the head of the MCP joints to above the elbow, ensuring the fingers remain free, wrinkles are removed, and the sugar tongue will be adequately covered at the elbow. The web roll or synthetic roll should be placed with a 1/2 overlap, and special attention should be placed on appropriately padding bony prominences. Utilize extra padding at the elbow while ensuring you do not place too much padding in the crease of the elbow. Your supply should be prepared ahead of time, including 15 sheets of plaster to ensure an adequate mold can be held. Dip your plaster in warm water and apply your sugar tongue splint with your assistant's help. Continue to ensure that at no point does either the volar or dorsal portion of the splint extend past the MCP joints. The fingers should remain free. Apply an additional layer of synthetic roll or web roll to hold the plaster in place, and follow this with an ACE wrap over the distal radius to aid in keeping the splint together throughout the molding process. Just as thumb holes were cut into the stockinette, you should do the same for the ACE wrap. A 3-point mold is then held. This can be achieved in a few ways, the easiest of which is utilizing both hands with the thigh positioned beneath the fracture site. Once more, in the majority of cases, a volar mold is held to maintain reduction, and thus this provides a reliable method for doing so. Ensure that the palm of the hands are the main point of contact for the splint to provide a flat surface. Ulnar deviation is often necessary as well. Allow the plaster to completely harden prior to finishing the dressing. Once the plaster splint has completely hardened, cut excess stockinette and fold it down. Proceed to then apply any necessary remaining ACE wraps. You should always finish with a post-reduction X-ray as well. Finally, it is critical to recheck a neurovascular examination, testing for a brisk capillary refill and the absence of paresthesia after the block has worn off. We thank you for viewing this segment of the South Pointe Orthopedic Surgery Residency Educational Series. We hope this video was beneficial and that you will utilize other videos from our series. as well as the correlating PowerPoint slideshows that expand upon each of the respective topics.